Hi, are you concerned with your children's health? Do you seem to think that they have an inability to remain calm or have trouble concentrating on situations that may happen in their everyday life, specifically as it relates to academic work or any other activities? While we know that pharmacological treatments for ADHD or attention deficit hyperactivity disorder are not always the best option, it could help to alleviate some of the symptoms that your children may be experiencing. Research by Heather Garand in 2020 noted that between 2006 and 2015, ADHD medication prescribed increased from 4.8 to 8.4%. Currently, ADHD or attention deficit hyperactivity disorder is the most common neurobehavioral disorder in children, affecting 5 to 11% of children and adolescents. This can be difficult to deal with, especially as parents, and it can also be a hard decision to make if deciding to prescribe medication to your children. However, you're not alone. Currently, one of the most widely used prescription medications for ADHD is Focalin XR, which is a stimulant medication used to treat ADHD. It belongs to the class of medications known as central nervous system stimulants. The extended release formulation provides a gradual and sustained release of the active ingredient, dexmethylphenidate, throughout the day. I'm here to tell you that there are some benefits. Focalin XR helps to improve attention and reduce impulsive and hyperactive behavior. The extended release also allows for once daily dosing, enhancing convenience and maintaining symptom control throughout the day. However, again, as once noted, we cannot expect to take medications without facing and considering some of the side effects. Common side effects of Focalin XR may include insomnia, loss of appetite, increased blood pressure, and even increased heart rate. However, it's important to know when seeking pharmacological treatments may be necessary. So let's consider some of the symptoms of ADHD. One of the most common symptoms is difficulty sustaining attention in everyday activities. Frequent careless mistakes or forgetfulness in everyday activities. Easily distracted by external stimuli, or difficulty organizing tasks and activities. Some of the hyperactive symptoms include fidgeting or tapping, hands and feet, or feeling the need to get up and move around, an inability to stay seated in situations where this should be expected. However, the impulsivity or the impulsive decision making and risk taking behavior is one of the most hyperactive impulsive symptoms. And this is typically what causes a lot of behavioral issues in school. Some of the cultural and religious concerns that come with ADHD medication can be seen by different cultures and religions. I think most importantly, it's best to ask your healthcare provider first and foremost on making the best informed decision for your children. This open communication can address some concerns and help individuals on about the best treatment options. In some cases, you may come to see that treating HD without non-pharmacological interventions could be considered. Again, it's best to talk to your healthcare provider. One thing to notice and to tell is that the current rate of ADHD, again, affects those 5 to 10% of children, and improvement rates may vary. If you combine medication such as Focalin XR with psychointervention or psychoeducation, it might be an appropriate treatment for your child. Please don't let your concerns get in the way of the best treatment for your child. Seek appropriate care and trust that Focalin XR could be the answer to your children's ADHD.